We're headed back to Smith Chiropractic as we're learning more about the spectrum of healthcare and how Dr. Jacobson can help you with your back pain.
All right, hanging out here at Smith Chiropractic once again with Dr. Jacobson. Okay, what room are we in right now?
This is an adjusting room.
Okay, so what would lead someone, or what issues would someone have to, get them into this space?
Sure. Initially, people are seeing me for pain. They're having stiffness, tightness, pain. So that usually gets them in the office where, we're kind of looking at low back pain, neck pain are the top two things that I treat. But we get into migraines and then tendinous things like tennis elbow, knee pain, ankle pain. So I really do work on the full body, but I'm a primary spinal pain specialist.
Sure. So then do you end up having people coming back here for like wellness reasons then too?
Absolutely.
Yeah.
There's patients that come in that see me and they have a problem and we want to get you functionally better. What does that mean? Well, I was able to sit in the bleachers at my kid's game. I walked around the neighborhood. I slept unmedicated. And once you're there, stress doesn't stop, right? And so just like in dentistry, you'll go in for a periodic checkup or a cleaning. Same thing with chiropractic. You come in, once you're well, we want to do the things that keep stress off your body and keep you in a good functional place. Yeah.
All right, we talked about how healthcare is kind of like a spectrum, right?
Yes, sir.
So if you had to put adjustments somewhere on the spectrum, where would it kind of land?
Yeah, we would be, if the right side was surgery, we would be over far on the left side. And this is evidenced by the malpractice insurance I pay. It's actually very cheap because what I do is very safe. It's non-invasive and conservative, meaning we're not going inside your body, and what we do doesn't have a lot of side effects. So we'd be way over on the conservative side.
I see. All right, what makes you guys different from other practices in the Springs area?
Yeah, we look at the patient very closely initially. You spend a bit of time with me and my staff on your first visit so we can talk to you, do the proper examination. We do take x-rays on you. Before I begin any treatment, I review that with the patient on what the condition is, and then not just adjusting fix everything, but the appropriate therapies. You might need more massage. You might need to stimulate healing with laser, or we need to create some space in your spine, which is decompression. So we're pointing to the correct therapies and not doing a one size fits all.
I see. So when would be the perfect time for people watching if they're experiencing some kind of awkwardness or some kind of pain? When's the best time, or when should they see you? If
you're not able to, and great question, if you're not able to alleviate your discomfort with just simple things like getting proper amount of sleep, nutrition, hydration, if it's persisting after that, especially if it's becoming more frequent, more intense, it's a good time to come in. Yeah.
I see. All right. Well, if people are watching and they want to come see you, where can they find you?
We're down on the south side of the Springs. Everyone knows Milton Proby that goes to the airport. We're just south of there, almost to Security Wyfield. Yeah.
Excellent. And then do they book appointments online, or can they make a call?
Either or. If you want to get online and book an appointment, or give us a call at the office. Absolutely.
Perfect. Well, Dr. Jacobson, I want to thank you so much for your time. We're learning so much of here.
I'm glad.
Next time we visit you, we might have to get a few adjustments, okay?
Pro bono.
Thank you so much.
I appreciate you.
Oh, Kenny, Dr. Jacobson, my back feels better already. You guys are amazing. This segment has been sponsored by Smith Chiropractic.